Good morning. Good morning. Thank you very much for inviting me to the 3P conference. How can digital health make person-centered, coordinated, and integrated care a reality? This is not a simple equation. As you can see, there are many variables and a common factor: care. Digital health, person-centered care, coordinated care, and integrated care. And during my presentation, you'll find out there are many other dependent and independent variables in this equation. The hypothesis for digital health is that it can contribute to meeting the quadruple aim goal in health systems: improving the user's care experience, for example, satisfaction, confidence, and trust; improving the health of people and populations, such as morbidity, mortality, quality of life, reduced hospitalizations; improving the cost effectiveness of care systems; and finally, improving work-life balance of healthcare professionals and cost effectiveness. Digital solutions for health and care can increase the well-being of population and radically change the way health and care services are delivered to patients, if designed purposely and implemented in a cost-effective way. Here's the cartoon of the three blindfolded researchers and the elephant. Digital health should enable us to see the overall picture of the person's needs and most appropriate interventions to obtain the best health and well-being outcomes. One issue we are facing in health systems is our ability to effectively wrap services around patients to support person-centered integrated care. While this requires services to be appropriately designed, digital health solutions can play a pivotal role in supporting these models, in particular by enabling information sharing. Making purposeful connections between information systems can be critical and requires that we understand, for example, the needs we are trying to serve, how services are structured and delivered, and what information needs to be shared to enable service delivery. Let me share a typical example of the web of care. In the diagram on the right, you can see the person and their care trapped in a spider web. The complexity in the way care systems are designed leads to a lack of ownership of the person's problem, a lack of involvement of users and carers in their own care, poor communication between partners in care, simultaneous duplication of tasks and gaps in care, treating one condition without recognizing others, and poor outcomes to person, carer, and the system. So what do we understand by integration and integrated care? Integration is the combination of processes, methods, and tools that facilitate integrated care. Integrated care results when the combination of these processes directly benefit communities, patients, or service users. It's by definition patient-centered and population-oriented. The point here is that integration tools are enablers to integrated care. Our society is changing, and digitalization is playing a big role. The tools, the enablers I've just mentioned, the digital solutions, an exceptional promise for improving health, well-being, healthcare, and reducing health inequalities worldwide. There are a promise of better information and a promise of better communication. But there are some challenges. On one hand, to ensure that all people enjoy the benefits of digital technologies for everyone, and that digital health leads to better health outcomes and personal experience. Digitalization can support the continuity of care across borders on one side and can help to promote health and prevent disease, including in the workplace. Can support the reform of health systems and their transition to new care models centered on people's needs and enable a shift from hospital-centered systems to more community-based and integrated care structures. Digital tools can translate scientific knowledge into helping citizens remain in good health, thus helping to ensure that they do not turn into patients. and digital solutions have the potential to enable a better use of the health data in research and innovation to support personalized healthcare, better health interventions, and more effective health and social care systems. While digitalization has been happening for years, its progress in the health systems has been uneven. Some commentators welcome developments as something that should have happened a long time ago, and others have cautioned against the quality of care and possible erosion of people's privacy. And to mitigate those uncertainties, there is the need for clear and transparent roadmaps and rules. In an interconnected world, this should come from a supranational level, taking into account the national and subnational context. And now I'm going to give you some examples of the WHO and the European Commission. From the WHO, I will highlight the key messages of the WHO Global Strategy on Digital Health 2020-2024, the WHO Guideline Recommendations on Digital Interventions for Health Systems Strengthening, and the WHO Classification of Digital Health Interventions. And from the European Commission, I will talk about one of the 6 high-level priorities of the current European Commission, the so-called A Europe Fit for the Digital Age and the European Health Data Space. And finally, I will give you some examples of European projects. The purpose of the WHO Global Strategy on Digital Health is to promote healthy lives and well-being for everyone, everywhere, at all ages. And we understand everyone as consumers, persons, patients and carers, health professionals, healthcare providers and industry. And to deliver its potential, a national or regional digital health initiative must be guided by a robust strategy that mitigates financial, organizational, human and technological resources. The implementation of appropriate digital health technologies is a key component of a national strategy. However, applying global solutions in a specific context can be a challenge. In this context, digital health strategy is understood to mean the field of knowledge and practice associated with the development and use of digital technologies to improve health. Digital health expands the concept of e-health to include digital consumers with a wide range of smart and connected devices. It also encompasses other uses of digital technologies for health, such as the ones you can see in the slide. Internet of Things, advanced computing, big data analytics, artificial intelligence, including machine learning and robotics, among others. In a nutshell, in the implementation of the action plan of the global strategy, we can see 4 specific target impacts: increasingly appropriate and sustainable health ecosystems, cost-effective and efficient health systems and services, accelerated digitalization of the health and well-being sector, and I would like to highlight the 4th outcome. You can see that on the bottom left of the chart, people empowerment to make healthy and health-enabling choices, and the target impact on the right to achieve healthier populations. The components contributing to digital health implementations are again part of an equation in which we find the health contents, the type of digital health interventions, and the digital applications. But there are some fundamental foundational layers in this equation as well. Specifically, a strategy in investment, legislation, policy and compliance, services, applications, infrastructure, and workforce. The classification of digital health interventions categorizes the different ways in which digital and mobile technologies are being used to support health system needs. You can see in the chart on the right that the guideline also targets interventions based on who and what. On who, clients, terminology which changes depending on the country, could be consumers, patients, etc. And health workers and health system managers. And on what? Data services. So how is a digital intervention defined? A digital health intervention is a discrete functionality of digital technology that is applied to achieve health objectives. As previously said, the range of digital health interventions is broad. and the software and the technologies that make it possible to deliver these digital interventions continue to evolve within the inherently dynamic nature of the field. There is a shared language to describe the uses of digital technology for health. And after this journey through the WHO initiative regarding digital health that set the global umbrella framework for digital health, let's move to Europe. In Europe, there is an average of 1.3 mobile phones per person. And the mobile technologies rates, at least in certain parts of the globe and in certain generations, are even higher than other connected technologies. But there is another reality, the digital divide. What is digital divide? It is an economic and social inequality in the access to, the use of, or impact of information and communication technologies. It is an inequality of access to healthcare due to inequality of access to digital technology, such as mobile phones, tablets, and internet, among others. However, mobile health applications can bridge the gap for people who are experiencing difficulties in accessing their personal health data, who do not have the capacity to do this, or who are not yet digitally empowered. The European Commission is developing several actions flowing from the overall priority of the Commission. Harnessing the digital transformation is one of the 6 high-level priorities of the European Commission for 2019-2024. This priority, entitled A Europe Fit for the Digital Age, as said before, aims to make sure that digital transformation works for people and the economy. Stella Kyriakides, Commissioner for Health, includes a mandate to create a so-called the European Health Data Space, to promote health data exchange and support research on new preventive strategies, as well on treatments, medicines, medical devices and outcomes, in compliance with the EU data protection rules. The European Commission has published several major documents listed in this slide, including a white paper on artificial intelligence, all available on the European Commission website. And what does the European Commission want? The European Commission wants to promote health records based on a common European exchange format, wants to give European citizens secure access to an exchange of health data across the EU. It specifically wants to support development of national electronic health records and interoperability of health data through the application of the electronic health record exchange format. Aims to scale up cross-border exchange of health data and enable the exchange of electronic patient summaries and e-prescriptions between member states participating in the e-health digital service infrastructure by 2022. Let's have a look at the 2 examples of pioneers in health digitalization, Israel and Catalonia. But of course, there are good practices in many other places too. The 2 examples have many commonalities in the development and evolution of health digitalization, and both are comparable to Norway, both in terms of population and socioeconomics. Just to give you an idea, Israel's population is 8.7 million and Catalonia 7.5 million, while Norway's population is 5.4 million as of 25 of November 2020. What have Israel and Catalonia in common? They have in common the level of development of health data sharing from electronic health records and personal health records and platforms to the integration of data from third sources. As you can see in this slide, the digital health model of Catalonia started in the mid-80s in the last century, with key e-health leadership and strategies evolving. Very similar to Israel, the unique identifier has become the cornerstone of the evolution of digital health, and currently the democratization and involvement of citizens in this process has produced tangible results with platforms designed with and for its citizens, in addition to a clear interoperability model and data analytics. In Clalit, the biggest SIG fund of Israel, serving 4 million clients, the data compiled from these sources are all linked by each member's unique ID number that's geocoded for their location of residence and where they receive services from their home primary care clinic. All this data is not just collected for storage, it is collected to be used to improve care and health services delivery. And furthermore, Israel has brought the 4 I's together: information technology, integration of care and data, innovation ecosystem, and alignment of incentives. Now I leave the examples behind, and one issue we are facing in health systems is our ability to effectively wrap services around patients to support person-centered integrated care. While this requires services to be appropriately designed, digital health solutions can play a pivotal role in supporting these models, in particular by enabling information sharing. Making purposeful connections between information systems can be critical and requires that we understand the needs we are trying to serve, how services and structures are delivered, and what information needs to be shared to enable service delivery. As you can see, the key value in this equation is the ability to different information systems, devices, and applications to access, exchange, integrate, and cooperatively use data in a coordinated manner within and across sectors, organizations, regional and national boundaries. And the glue to that is what we know as interoperability. And why is interoperability important? The benefits are wide and contribute to improve integrated care service delivery. For health and care professionals, strengthen coordination to improve quality and safety, better access to patient information and decision-making supports. For patients and citizens, improved integration of care and enhanced safety. For users, lower cost for implementation and integration. And for health and care businesses, expanding markets, opening up competition, and reduce costs to developers. And once data is collected from different sources, what next? The Venn diagram on types and subtypes of artificial intelligence show that machine learning algorithms can be considered as a subgroup within artificial intelligence, while deep learning algorithms are a special class of machine learning algorithms. So artificial intelligence is fitted for decision-making purposes, research, innovation, planning, service redesign, care improvement, testing, and ultimately for improving health and well-being of individuals and populations. The chart on the left shows the synergies that are currently appearing between research and clinical settings with the aid of artificial intelligence-enabled capabilities. The chart on the right shows that artificial intelligence is an opportunity to reshape healthcare. That's wonderful. However, the deployment and integration of artificial intelligence-based technologies with the potential to significantly change the patient care pathway should proceed in a controlled way with continuous monitoring and adjustment. In addition, funding schemes may need to be re-evaluated to ensure high-quality care for everyone, particularly the most vulnerable. And now I'm going to show you a few examples of European projects on digital health. The first project I'm going to show you is the SCIROCCO project, which developed a maturity model into a validated and tested self-assessment tool that facilitates the successful scaling up and transfer of good practices in integrated care across European regions. The SCIROCCO maturity model has 12 dimensions, a specific one on information and e-health services. In the slide, you can see the digital health requirements for a successful integrated care. The SCIROCCO self-assessment tool is an online tool with an objective to assess a country, region, or any provider's readiness for integrated care. It builds on the conceptual maturity model for integrated care, and it consists of an online maturity assessment questionnaire organized along 12 domains, and the SCIROCCO maturity model for integrated care and the assessment scale. Here you can see the domain of information and E-helse services, and the spider diagram illustrating the assessment outcomes. This offers the opportunity to share and compare spider diagrams of different users as a basis for consensus building. The SCIROCCO self-assessment tool can be accessed online by using the link that you can find on this slide. This is an example of the self-assessment done by the Norrbotten region in Sweden. The link is on the top right corner of this slide. Another project I want to share with you is Digital Health Europe. Digital Health Europe is a project that aims to support the larger scale deployment of digital solutions for person-centered integrated care, and to support the digital transformation of health and care innovation through collaboration in multi-stakeholder communities, as you can see in this slide. Focuses on importance, relevance, added value, maturity and transferability of digital solutions, and aims to ensure citizens secure access to and sharing of health data across borders. Better data to advance research, disease prevention and personalized health and care, and digital tools for citizen empowerment and person-centered care. The unquestionably needed reform of health and care systems in Europe requires the adoption of innovation and integrated solutions. EURIPHI is a European project that aims to support building out a Europe-wide community of practice of public procurement organizations in the health and care sector, which aims to address common unmet needs and shortcomings in the current health system and care delivery by using innovation procurement. In the diagram on the right, you can see the key steps in the process: needs assessment and demand-side organization, solution requirements definition, open market consultation, and finally the tender process. Let's focus on one condition as an example: stroke. In the graphic, you can see the analysis of care delivery shortcomings and the definition of the initial list of procurement objectives for stroke. A stroke is a complicated, heterogeneous condition with acute onset but complex and enduring treatment and follow-up. Consequently, stroke care is complex and covers a whole spectrum of care, including prevention, early diagnosis, acute care, rehabilitation, and long-term care, with in-hospital, outpatient, and community-based care. Stroke care is thus, by definition, multidisciplinary, and the integration of care is of particular concern. If we focus on prevention through supported self-care, prevention is a key topic, and many traditional risk factors for stroke are well researched by now. Individual factors of stroke, as you can see in the picture, are hypertension, cigarette smoking, diabetes, atrial fibrillation, carotid stenosis, among others, and many of them being interrelated. Many people with diabetes, for example, also have high blood pressure, high blood cholesterol, and are overweight, increasing their risk even more. Diets with high saturated fats, trans fats, and cholesterol can raise blood cholesterol levels. Diets high in sodium, salt, can increase blood pressure. Diets with high calories can lead to obesity. Investing in stroke prevention through diet or behavioral changes is thus crucial to public health. It is decisive to involve the patient as early as possible in any early prevention strategies, if lifestyle changes are recognized to be the best approach in stroke prevention and risk management. And from the demand side, currently, a stroke poses a tremendous medical socio-economic burden in Europe. Approximately 900,000 Europeans suffer an ischemic stroke each year. About 25% of men and 25% of women can expect to suffer stroke if they live to be 85 years old. This leads to an enormous cost for treatment and rehabilitation amounting to 38 billion euros each year in Europe. In extrapolation, by 2025, more than 1.5 million strokes are expected to occur in Europe each year. Currently, more than 6 million Europeans live with the effects of stroke. A key issue for prevention is how to inform society about effective prevention strategies and to best reach people at risk, especially in areas with low levels of health and digital literacy. And what about the care delivery shortcomings, the pain points? I'm going to list a few of them. So existing tools are too simple, not personalized, and lack integration. Social economic disparities exist. Existing racial disparities in stroke incidence highlight the importance of stroke prevention interventions aimed at minority groups. Lack of bidirectional connectivity of devices, no real harnessing of ICT and technology features in health promotion. We're still using PDF leaflets. Putting the scope of responsibility only in individuals to change their behavior is futile, as social determinants and social aspects affect individuals' capacity to change their behavior. So, this example of prevention through supported self-care can also be done for early diagnosis, acute stroke treatment at hospital, post-acute rehabilitation, chronic treatment, and as you can see in the slide, and reintegration. Lots of figures, just double checking my notes. So let's continue. Then if we look at the integrated care procurement objective, the solutions should address lack of electronic care record data integration from technologies designed to motivate and educate people, as well as enhance the interface between person and their care team. Address lack of integration of nutritional and physical activity information and advice. For example, innovative solutions should be expected to be supported, which allow patients to track a range of parameters including blood pressure, weight, impedance measured fat, fluid intake, muscle action, physical activity, carbohydrate intake, and stress levels. The link of stroke risk management results with an interface for care practitioners to ensure that the identified person with high risk of stroke can be monitored and followed up. For example, risk calculation and therapeutic recommendation tools should be personalized, addressing data sharing and infrastructure needs, such as integrating highly heterogeneous multi-style data sources, integrating omics data into clinical care, and integrating imaging data. That sounds future. Then the provision of multiple channels to establish bi-directional communication of text, images, voices, video should be addressed as well. Improved transition from hospital to community setting. Innovative solutions should tackle the need of patients and family carers receiving the necessary training to enable a successful transition to the home environment. Find an anticoagulation dosing software system as well, interfacing to relevant IT systems, for example, hospital and GP patient records, as well as to devices and any mobile applications. And answer client information needs that change over time. ICT tools should facilitate self-care during rehabilitation, especially home-based rehabilitation, from the patient's perspective. And this is just to list a few. The final objective is to procure innovations that tackle all these issues, and as you can guess, many of them are digital solutions. And what is the patient's position on digital health? I take the example from the European Patients Forum position on the new European Commission portfolio on digital health. The European Patients Forum supports efforts to promote electronic health records based on a common exchange format. However, they stress that the involvement of patient organizations and further research are required to better understand and implement user requirements at EU and national level. Better access to health data can significantly support the work of regulatory bodies in the health system, the assessment of medical products, and demonstration of their safety and efficacy. Patients have the right to access and control their personal health data and to request their portability. But implementation of this right is fragmented. While the General Data Protection Regulation has created a harmonized European legislative framework for the use of personal health data, the European Patients Forum calls on the EU to closely monitor the application of the Data Protection Regulation and encourage digital service developers to consult with patients to ensure their privacy consents and needs comply with the Data Protection Regulation requirements for consent. The European Patients Forum message is clear. Digital tools should start from the needs of healthcare users and be developed with the users to ensure technology actually facilitates participatory, person-centered healthcare and leads to better outcomes for patients and better value for society. And digitalization needs to be integrated as part of a national and European strategies to tackle health inequalities and avoid creating a new digital divide. COVID pandemic has led to a rush to implement digital health services, including telemedicine consultations, and in many countries at a scale and pace that is unprecedented. Other countries have seen an explosion in demand, but run up against limited infrastructure and technical resources as well as staff. The response to COVID-19 has highlighted weaknesses in our health data collection processes, as it appears there is little consistency between the way countries are recording infection rates, deaths, who is being infected and dying, where and when. Digital tools are proposed as a solution to controlling the spread of infections once countries start relaxing initial controls. What is clear is that the pandemic has revealed the urgency of finding effective digital solutions that really work for patients. Digital solutions can support alternative options for care delivery. Contactless healthcare encounters are essential for resilient healthcare in the current pandemic. And there is evidence that big data and artificial intelligence have contributed to the development of most of the COVID-19 vaccines. I started with a brush and a color palette, and I finish with a blend. And obviously my suggestions for take-home messages. Digitalization is a fast developing trend that will have a profound impact on all aspects of our societies. Digitalization is often cited as a solution towards sustainability of healthcare in a context of growing health demands due to demographic change and shortages of healthcare professionals. Seamless connections of data flow, information sharing between health professionals and between patients and healthcare professionals leads to improved patient safety, reducing the number of avoidable mistakes and adverse events, and improving the coordination of care and better adherence to treatment. Digitalization holds many promises for patients, carers, and health systems. However, there is still a gap in the development of the patient-centered digital health with equity of access, patient safety, and quality of care. Digital transformation of healthcare plays an important role in digitally advancing person-centered integrated care. And finally, digital healthcare offers a unique opportunity for research and innovation, as currently seen in the development of hopeful vaccines. Tusen tack. Thank you.